first word that I think of would be professional or distant.
My own doctor, my own pediatrician, and my allergist.
Money.
Reliable.
Cancer.
Probably like stethoscope.
Hospital.
Rooms like waiting rooms, offices, and examination rooms.
Expensive. Definitely expensive.
Most of the doctors I've had have always just been at a distant or just very professional. They use those big words and they try to explain it to you, but that's usually when the nurse comes in. But the actual doctor is never really there with you one-on-one, so they're just kind of distant to me in my head.
I spent a lot of time with them when I was little.
They go through a lot of years of schooling to either become like a surgeon, and I guess I think of surgeons when I think of doctors, and they make a lot of money for my ability.
Because there's been a lot of people in my family who's been like affected by cancer. I didn't get to meet either one of my grandpas because they both died of cancer. One of them died of bone cancer and the other one died of brain cancer. And my aunt has breast cancer. And then when I was in 4th grade, we had a kid in our grade die of leukemia. So as a grade, we kind of carried that throughout like middle school and high school.
The last couple of times I saw a doctor, it was in a hospital, so that's why I succeeded. I sprained 2 ligaments in my ankle. I broke 2 bones in my hand. Specifically, the doctors weren't bad. Like the whole hospital experience is kind of rough because it takes so long. But the doctors themselves were pretty nice.
My relationships with doctors, I guess, would just be your average relationship. I guess normally they know me by name, but a lot of the time doctors and nurses will call me Lena, even though my name is Lena. And so when they do get my name right after a while and they call me Lena, I appreciate that. So the ones who actually know my name and know how to say it correctly, I think I have a better relationship with them. But I mean, I've never had any major medical anomalies about me or anything, so I haven't. I mean, I guess my dermatologist is the doctor I would be going to most frequently, but that's also the one I've changed most frequently. I've had 3 dermatologists, and my most recent one, I like him the best just because he's very real. It's not like you're talking to a doctor. It's like you're talking to someone you know who is just easy to talk to, but also knows what they're talking about in terms of like the medical condition or, you know, whatever you're going to them for help with.
It really depends on the doctor. I find that some are much better than others, and it's basically that I like doctors who explain things well, who take the time to treat me like a person. I've had doctors, I've moved recently from New York to Texas, and I had to go and get A to Z new doctors, regular practitioners, dermatologists, gynecologists, eye doctors, you name it. And for the, you know, it really varies on the amount of time and eye contact and the way they communicate with you. It's been very different depending on the doctor. What comes to mind, I recently had my first eye doctor appointment. He was highly recommended. And he walked in with a clipboard for the first time. And he said, "Hi, I want to introduce myself." And he was just like this. And I couldn't believe it. He shook my hand. And he never looked at me. I made some kind of joke. He said, "Ha ha," like he had no idea what he did. And I was like, it was so brief.
I think that a lot of my experience have been negative because doctors are under such pressure to continuously make money in order to please insurance companies and obviously to please themselves. So they have 20-minute time slots for all these patients, and yet you only have like 5 minutes with a patient. And when I'm with a doctor, they're like on their iPads or like writing intake, and they're not even asking me the questions that I want to be asked or listening when I feel that I need to say something. They're just writing things down in order to get the job done and submit it to their higher people. My positive experiences with doctors have been people who take the time to get to know me as a person. They know my family. They're a family doctor. They respect my social life, respect my like personal health outside of what they're asking, and I think that there's a big contrast right now between people who actually care and people who just want to make money.
And I feel like there's so many steps involved before you get to see the doctor. It's almost like everything else has already been done and decided before you actually sit down, and the buildup is there, and then there's nothing once you get there. What they're having us do, I don't know if this is universal now or just with the Texas healthcare system. I find a doctor, I do my research online, or I get recommendations, and as I go forward, I have other doctors recommend other doctors in their practice that they're associated with, make the appointment, and then you're asked to go online and print out probably about an 8-page form, which you're to have already done and brought to the appointment. And lists all the usual questions, your medical history, the drugs you're on, what your problems are, your family history, and insurance, and a lot of signing off on, I don't even read it, it's really bad. Privacy issues and pages, mostly a lot of that. You have to remember, when did I have this surgery, how many milligrams am I on Ravicol, and it's annoying, and each doctor have to redo that, and I don't know why there's not just something online that they, especially if they're in the same group, that I wouldn't have to do that. So that's time, so you come to the appointment, and you wait in the waiting room, then they call you in, and usually a PA, a physician's assistant, will ask you the questions, and it's the things that were already on the form, what drugs are, so you repeat all that. They don't seem to look at it, I don't know where it goes once you get to the doctor, and see, I don't know, they just toss it in the garbage, and she types something on her laptop or iPad or whatever, and then you're left there waiting for the doctor. So by the time the doctor shows up, you're already sick of the whole thing, and you hate to keep repeating it because it's depressing to go over all the things you've had wrong with you, especially if they're things that are not even related. You go to eye appointment, you have to bring up when you had your gallbladder out 26 years ago.
The first dermatologist I went to when I was like from 6th grade to maybe freshman year, I went to him. And my family refers to him as, or my grandparents refer to him as the butcher, because my grandfather was dealt with things with skin cancer and things like that. Anytime this dermatologist would see anything remotely wrong, that he would just remove it, dig it out, so that's why they referred to him as that. But he was just always, like, from a young age, I went to them, or to the dermatologist for acne and things like that, and he, even when I was like 13 years old, would recommend me going on Accutane, which is a very dangerous and scary drug, and I was way too young for it, and he was very pressing of it, and I didn't like that because I was afraid of it at the time, and I don't know, I just felt like every time I went to him we were going around in circles and nothing ever got accomplished.
So, doctor comes in and starts from ground zero. So what's wrong with you, and what's your ankle? And so it's like, did you look at the form? Did you listen to your PA? And then some doctors will sit with you in their office behind a desk and look at you in the face and make eye contact and explain what they feel is the necessary test and what their options are and what their recommendations are. And then I've had other doctors who are on the fly, they examine you and they're just throwing out all these things and you're just like dizzy, and they're not explaining, and all you hear is cancer. All you hear is tests and MRIs, and you walk out and you're just so confused and just so anxious, and you just don't know how to sort out all that information. It was never explained to you well.
So then I think either he recommended or someone else recommended the next dermatologist I went to, and he was a lot better and I enjoyed going to him, and I actually did go on Accutane with this doctor, and then afterwards he wanted me to go back on it. And even when I would say I did not want to because it was a very negative experience for me, he would still bring it up as if it was a possibility, and to me I just thought that was insensitive. And eventually he recommended my next dermatologist after I went to him for about 3 years. in regards for laser treatments. And so when I went to this new dermatologist about a year ago, he was the one that I felt was most comforting and, you know, real to talk to. And I ended up going to him for, you know, like monthly or like every 3-month checkups, aside from the laser treatments, just because I liked him a lot better.
So it's not that they're bad doctors, they're just bad communicators. So then you leave and then you have to follow up with other doctors, and they don't seem to all communicate, that's the other thing, with each other well. And you may be getting tested for the same thing that they can all consolidate information. So there's a lot of money spent on the test, and a lot of time and a lot of anxiety. And then you wait for the results. You don't always speak to the doctor, some do. Mostly it's a nurse, and they're not really, they give you like a number, and they don't explain what this number means. And for the most part, you know better off than before you start this whole process.
I think something that's really important in the ones that have been positive is touch, because if you don't have like that emotional connection with someone and you're just like in the corner of the room being like on your computers and not paying attention, not even giving you eye contact, like it's people who like touch you on the shoulder and ask you how you're doing and ask if you're gonna be okay. If you are okay, like I think stuff like that is really important because they're more open and they pay attention to you instead of the people who don't even look at you, don't even recognize you as a person. I've had doctors who call me my sister's name, which is, you know, not very cool.
So it's very frustrating, and I feel that it could be consolidated better, communicated better, and there should be a program that you're following, and all the doctors should be in consult with one another. So this wouldn't be such an overwhelm. You end up spending so much time going to the doctor, and waiting for results, it can become a job. So I'm glad that I'm here and I'm well. But I don't know if I'm under-tested or over-tested. Spend a lot of money on this, but insurance doesn't cover everything. And, not sure if it's worth all the time and money I've spent on going to doctors.
What's the first word, sentence, or phrase that comes to mind when you hear the word doctor?
Wait, where's the
Who?
other paddle? Oh, it's behind you.
Why?
Exactly.